before the interview started today, there was a bit of nerves around, oh my God, am I actually going to release an episode where I'm talking to my therapist and I'm interviewing them? Up until yesterday morning, I was thinking, this is a great idea. And then yesterday morning, I'm like, oh shit, is this a bad idea? It felt like, wow, this is very vulnerable. One, to just be putting it out there to the world who my therapist is, but I also have to practice what I preach, and I advocate that therapists need therapy too. So this has been cool. This has been outside of my comfort zone, absolutely. So thank you for being a part of that, because this is a cool step towards growth.
Yeah, absolutely. And it's a unique situation. Most clients of therapists are not going to invite their therapist on their podcast and say, "Yes, my therapist." And most therapists are not going to start disclosing extensively about their own personal struggles.
Hi, everyone. I'm Kirsten Davidson, your host and creator of my wellness podcast, Mind the Gaps, surrendering our typical ways of looking at life to step out of our comfort zone and into our growth zone. Welcome to episode number 17, Therapist Remix, where I'm joined by my psychotherapist, Daniel Farb. Daniel is a registered psychotherapist living and practicing in Wasaga Beach, Ontario. He works primarily with adults and has a specialized interest in helping people to understand and heal from the effects of relational, developmental, and attachment-based trauma. Recognizing that there isn't a one-size-fits-all approach to therapy, he describes himself as an integrative psychotherapist with an emphasis on modern psychodynamic approaches, including internal family systems and relational psychotherapy. He's passionate about helping people to heal from their psychic wounds and grow beyond self-imposed limitations so they can live meaningful and fulfilling lives. In addition to his professional qualifications, he also identifies as having experienced mental health and addiction challenges in his own life, and he uses his personal experiences as part of the knowledge base from which he helps his clients navigate their own journeys of healing and recovery. Beyond his work as a therapist, Daniel enjoys writing poetry, prose, rap lyrics, and records music under the stage name MC FÜBB. That's MC FÜBB. Be sure to check out his music on linktree.com/MC FÜBB. You can also find him on Instagram and YouTube at Daniel Farb Psychotherapist, on Facebook at Daniel Farb RP, and you can also visit his website at danielfarb.com. In today's episode, Daniel and I dive into the meaning behind his song lyrics and personal experiences related to addiction, perfectionism, and limiting models of mental health care. As a trained professional in one of my favorite therapeutic approaches known as internal family systems, Daniel shares how we can unburden ourselves from the past by considering how we're made up of multiple parts, familiarizing ourselves with these parts of us, and integrating these parts to work as a system, as a family. As a disclaimer, this episode is not a therapy session. For this next hour, you'll find me in the role of an interviewer and Daniel as an interviewee. It was this role reversal and the context of Daniel's musical background that gave way to today's episode title, Therapist Remix. For all things Mind the Gaps, you can find me on Instagram at kirsten.davidson. I'm happy to answer every single one of your questions, comments, or feedback, and most of all, I'm happy to have you as part of the Mind the Gaps community. If you're interested in booking a therapy session with me, please feel invited to email me at kirsten@mindthegaps.co. You can also schedule a session online through the link found on all of my social media platforms. Thank you so much for tuning in, and I hope you enjoy. Hi, Daniel. Thank you so much for being with us today.
Good morning. It's a pleasure.
I started off today's episode by asking Daniel if he could tell us more about his journey into the separate and interconnected worlds of psychotherapy and music.
Yeah, so the music thing kind of came before I started getting training to become a therapist. I'd done my undergrad and I studied psychology and philosophy, and then over the course of that, decided I really wanted to pursue music as a hip hop MC, or more colloquially known as a rapper, and figured if I'm gonna, give it my all and go after it, now's the time. Once I got more established in a different career path, it'd be very hard to give it my full attention. So I did that for about 3 years as like my main focus after undergrad, and just basically supporting myself financially by being a server at the time. And I got to a point with that where I realized, one, it's incredibly difficult to make a living doing music. So I had to go through a bit of a spiritual crisis,
Mhm.
figure out what I wanted to do. And really, I mean, one of the reasons I got into doing the music was wanting to make a positive difference in the world in some way. I got back to my interest in psychology, my own personal experiences being a client of psychotherapy made me realize I want to pursue that. And so that's when I started to make the transition down that path, proceeded with the psychotherapy career from there. So they've always kind of been separate for me. Even my stage name is like an alter ego, MC FÜBB. I don't go by my real name. I'm still one and the same person. So it's definitely a different part of me, or different parts of me that get channeled through the music that maybe don't get expressed or wouldn't get expressed in my regular life, and certainly not in the way that it comes out as an art form.
Mhm. Mhm. And then your most recent album in 2019 does cover a lot of topics in mental health. So that's what I found really interesting, that overlap. This came up in a session with myself and Daniel, and you had shared that you do create music. And I was like, oh, okay, I'm going to look this up after. Then I listened to the lyrics and it was like, wow, there's a lot of overlap in your views on the mental health sphere and mine as well. And a lot of things that I've already covered in this season of the podcast. So I thought we could dive into that, into some of the controversial topics and more popular topics in mental health, and the poetry that's behind those lyrics that you've then put into music. I think that's a really cool outlet for it.
Yeah, that was my most wholehearted attempt to really synthesize my two worlds of, the
Mhm.
mental health world and psychotherapy, and that journey, doing it through hip hop music. So much more directly touched on a lot of topics in there, like depression and, the role of medications, perfectionism. So it was, in some ways very cathartic to do. In other ways, one of the more challenging projects I did, because I had to delve into things that are more related to the past. Also encounter my own resistance to exploring certain topics within myself and putting it out there, and really being vulnerable at the end of the day, perhaps in a way that I haven't been through my music. At
Yeah.
the end of the day, I'm really happy with the finished product. I'm glad I did it. Got pretty positive feedback. So
Yes, the music you were doing before was quite different, like same in style, but different in messaging compared to your album, The Wounded Healer. And
mhm.
there's a couple songs in there that stood out to me, the lyrics. So the one, Dear Doctor, there's a few points in there that I found really relevant. One of them being that psychiatry you had said psychiatry is an art that's far from perfected,
Mhm.
and lots of messaging around diagnostics and medication, and a lot of that stuff is not necessarily talked about in the sphere of psychotherapy. When we're working with clients, we're not always delving into that,
Mm.
because that's more in the realm of psychiatry. So anyway, I'm curious to hear your thoughts on that, the kind of the message behind
Yeah.
the lyrics in that song.
But I'm a human being that's sick of being treated like a patient. Your perspective is just a perspective. Psychiatry's an art that's far from perfected. I object to any methods trying to label me defective. Doctor, I don't need another pill. I just need someone who can listen to me. I don't just need a prescription pill.
I mean, I'm coming from a couple of places. One is my own personal experiences with the medical system when it comes to mental health, seeing different psychiatrists over the course of my life, especially in my teenage years and
Mhm.
younger years. And, some who were very good and helped me a lot, and others who maybe actually did some harm. So I also, before I became a psychotherapist, I was a peer support worker, and learned a lot about the consumer survivor kind of movement, and everything from anti-psychiatry to calling for like more collaborative and humanistic based psychiatry.
Mhm.
And if you look at the history of psychiatry, I mean, it there was no difference between psychiatry and psychotherapist back in Freud's day. Like, he was a psychiatrist, but he was also a big pioneer of Western psychotherapy.
Mhm.
And then over time, it became there became more of a rift. There was more increasing medicalization, especially in recent decades. The biomedical model has become very dominant. They're still influenced by all the stuff that came before, but for the most part, in our system here in Ontario anyway, psychiatrists play the role of medical consultants who specialize in what they call mental disorders or disorders of the nervous system or whatever you want to call it. And, they diagnose and they make prescription recommendations. Very few have the luxury of actually getting to know their patients in depth and doing in-depth psychotherapy with them because
Hmm.
of for a number of reasons. The other thing is that there's a lot of power dynamics at play. So someone who's in the position of psychiatrist who's specialized in this, gone through 9 years of medical school and specialized training to get there, it's like that word is taken very seriously and has a lot of power and influence, especially in the medical field over, your family doctor is going to listen to their recommendations and often defer to them. And so if what they're saying is taken as the gospel and it's only in a very limited sphere of like, this is what I think is wrong with your brain and this is what you need to do to treat it, it can leave out a lot. And it can
Hmm.
leave out a lot that we cover and explore as psychotherapists, just what overall makes someone a human being and all the different aspects of them, the different parts of them, the things that influence their lives. Trauma is one thing that's been significantly neglected in modern psychiatry. I mean, they have the PTSD diagnosis, but beyond that, acknowledgement and treatment of that in a holistic and in-depth way is very much missing to a
Hmm.
large extent. Mostly it's focused on treating symptoms
Right.
and reducing symptoms. And it comes from a good place, the desire to reduce suffering, alleviate suffering. And sometimes it's very helpful, but other times it's not helpful, and other times it's actually harmful.
Hmm.
And so that was all of that in a nutshell is what made me make that song.
Hmm.
And channeling the sort of the anger that I have felt at times that I know many people have felt towards that profession for its shortcomings and the lack of acknowledgement of those shortcomings,
Hmm.
right? I'm painting broad strokes and obviously taking a critical stance. There's a lot of good psychiatrists out there. There's a lot of them who probably would, watch that and listen to that song and take a lot of merit from it,
Hmm.
and think there's some good points. And there's certainly a lot of very severe, mental illnesses where it's like psychiatrist is your best bet because no one else is going to know what to do with that stuff,
Hmm.
right? But that's not necessarily the majority of people who are seeking help for their mental health.
Hmm. For sure. It was almost regarded as the standard treatment. And now, even the way you're describing it, it's looked at as more of a niche treatment, right? For specific things that might not be able to be helped with talk therapy in psychotherapy. But I really like the line in that song, there's more than a dysfunctional brain to these depths of despair and psychological pain.
There's more than a dysfunctional brain to these depths of despair and psychological pain.
I like that because it really sums up how it's not as simple as there's just something inherently wrong with us, right?
hmm Yeah, and even if you take the lens of just looking at what's going wrong in the brain, which again they have more theories than practical scientific evidence for a lot of this stuff. A person's brain gets to be the way it is, not out of nowhere. Like there's
Mhm.
certainly certain disorders and certain conditions that have a higher genetic predeterminism or risk factor to them, but the vast majority, it's not just, oh, your brain's faulty, you need to treat it. It's like, well, there's a whole story to that. There's a
Mhm.
history to how the person became that way, and the genetics are certainly part of it. But for a lot of people, especially people who have the most common presenting mental health concerns like depression, anxiety, it's not that simple. A lot of it, as we know as therapists, comes from your life experience all the way back to infancy and onward. So
Mhm.
that not being acknowledged and not being addressed really, I think, limits people's capacity to heal and grow. And if you buy into that, it's like, well, my brain's just faulty and I need meds, and that's the whole story.
Mhm.
Um, Maybe the meds help you and you're on your merry way, but for most people, it's not enough.
Right.
And if that's the story they've been told, then it just becomes a game of, oh, I must need a different medication. Oh, I must need this. I must need that. It's like, well, what about everything else that makes you a human being other than tinkering with your brain chemicals? And that's
Mhm.
where, there's a lot of lip service paid to that stuff, but how many resources are actually devoted to helping people meaningfully explore that, which is what we do in psychotherapy to a large extent.
Right. And all of what you're saying is reminding me of your other song on the album, Opioid Crisis, which talks a lot about addiction and narratives around addiction. And my favorite line from that Also from Gabor Mate, don't ask why the addiction, ask why the pain.
Don't ask why the addiction, ask why the pain. Ask anyone addicted and they'll tell you the same. Ask them what it feels like without that drug in their veins. What would you do if you felt raw every minute of every day?
Can you tell us what you mean by that and what he means by that?
Yeah, so I mean, you can take the view and the medical view, and even in the 12-step, recovery community, that addiction is just a disease in your brain, something wired differently, and therefore you need to treat it.
Mhm.
That approach or that perspective can be useful, and at least takes the maybe some of the shame out of it and helps people separate themselves from this addictive process that's consuming them and help them to work with it and address it. But again, uh, you can say, "Oh, you're just born an addict, and you've always been an addict," and it's maybe there's some truth to having some people have more of a proclivity towards addiction or addictive personality, whatever you want to call it. But the whole message is that people are using, uh, drugs to self-medicate. They start doing it for a reason, and
Mhm.
it's often not just my brain told me to because I'm an addict. It's because they were trying to deal with something. They were trying to deal with, you know, difficulties in their life. They were trying to deal with mental health symptoms. They were trying to alleviate the effects of trauma or chronic pain they're dealing with. So, not understanding the whole origins of how that comes to be, and then at some point meaningfully addressing those problems with living, really. And that's actually a comes out of the 12-step community, and they do acknowledge it's like once you got sober, now you have to do the real work, which is
Mhm.
like deal with your problems with living and your problems with life, and what are those problems and how do we address them. So Gabor Mate's whole thing about don't ask why the addiction, ask why the pain, because you're missing out on most of the world of what had that person become addicted in the first place. And by not addressing it, um, the likelihood of meaningful lasting recovery, I think, is much lower, and
Mhm.
certainly the likelihood of actually having a fulfilling and meaningful life are greatly reduced. So the whole opioid crisis thing is there's so much. Oh, look how many people are dying, and it's like it's the people who are the most often the most marginalized, often the lower socioeconomic status, histories of intergenerational trauma. If you look at our indigenous communities, it's like you know, again, it's like how do we fix this? How do we stop people from dying? Well, dying is the end result, right?
Mhm.
Um, there's stuff that goes way back that if you don't meaningfully address, you're not going to meaningfully address the opioid crisis. You might
Mhm.
help people live a bit longer, and with like safe injection sites, stuff like that, those kinds of initiatives. You may help people perhaps be treated with more uh, compassion, which I think is the direction you need to go if you want to start helping people actually heal.
Mhm. Yeah, and that's a radical shift from a lot of stereotypes that people hold against quote unquote addicts, right? Tough love compared to compassion.
Yeah, and I think there's a place for both, but so often it's the tough love kind of approach and the absence of compassion. I mean, people will internalize however they're treated, right? So people who are addicted often are treated with scorn and derision and judgment, and so they
Mhm.
internalize a lot of shame,
Yeah.
and that actually makes it harder to seek help and get help.
Exactly. And I have some family members that have gone through 12-step programs, and I've definitely seen the benefits of that because it isn't just being, as they call it, like a dry drunk
Hmm.
or just being sober. You're actually working steps, working a program, and the program's great. I mean, I think even anyone who's not an alcoholic should take a look at it. It's got some pretty good principles in there. If you're comfortable, Daniel, I'm curious to hear your experience with addiction or with mental health concerns surrounding addiction, only if you're comfortable sharing.
Yeah, no, definitely. I'm don't know if I'll ever be fully comfortable, but I'm definitely willing, and I,
Mm,
I do I do I even write on my website I have experience with that stuff because I think sometimes it's helpful for people to know that, and I know for myself it's become like an experiential knowledge base from which I can understand and help people.
right.
Yeah, I mean, the allure of it for me of any kind of substance use started in my early teen years, around 13, 14. I was always interested in alcohol and wanting to try it, and coincidentally, probably not around those ages is where I started to experience, my first inklings of depressive kind of symptoms, existential angst, all that kind of stuff. So
Mm,
I pretty quickly in my high school years got into drinking a lot and smoking a lot of weed, and weed for me has been the primary addiction that I've struggled with in my life. And so I went down a pretty dark path pretty quickly from 14 years old till 19 years old, where I really hit sort of a bottom and decided to get some help, and actually
Mhm.
went into treatment for addictions and addressing my depression, and then into the whole 12-step thing and that path to recovery. So at a certain point realized for myself the limitations of that, approach, and had to go into more intensive psychotherapy to
Mhm.
address, the deeper origins of this, like developmental experiences and trauma that I've been through, to really get a handle on it, and free myself up to not just feel like you said, the dry drunk and suffering just without the substance. Because you can find other addictions. I found other addictions:
Mhm.
television, video games, eating, whatever, right? There's so many things we can become addicted to. And so that, what for me, I find the difference between when I'm driven by that compulsion versus not, and this is something I still keep learning and relearning, is how much in touch with core values and living consistently with that, as well as really taking care of myself,
Mhm.
right? Managing present day stressors. For me, the sort of thing around developmental trauma is more of a self neglect kind of thing, where I can get into habits of just ignoring my levels of stress, not taking care of myself, and then lo and behold, I'm doing things that aren't good for me to cope, right?
Mhm.
And I think that's one of more of the insidious impacts of trauma, is stuff that doesn't happen, emotional neglect or abuse or whatever it might be, not internalizing that, thinking of how you're feeling, taking care of yourself, setting limits, actively doing things that are healthy for you. That's always been my main area of struggle, and then one that I'm continuing to learn and work on.
Mm. Well, thank you for sharing that. I appreciate it. And I'm curious with trauma, because that's a broad topic as well. What would you say are some things that people who maybe aren't in the world of psychotherapy wouldn't consider traumatic or wouldn't consider traumas compared to the general kind of like PTSD label and things that might be associated with that, like war or famine or very large
Mhm.
scale things?
Yeah, I mean, sometimes in some of the literature they talk about capital T traumas, like the ones you're talking about,
Yep.
where anyone would look and be like, of course you're going to be traumatized by that, or how could you not be? There, even with that, there's some people who would say get over it, it's in the past, because they have no idea what trauma is. And
Hmm.
then there's like the lowercase t traumas, which I consider anything to be traumatic if it is an adverse event or events or things that happen to you that have a lasting impact on your nervous system, such that it's limiting your capacity to live freely and live a healthy and fulfilling life. So it could also be things that haven't happened to you. So a lot of times when I was talking about like the emotional abuse or neglect, it's like lack of experiences of nurturing or emotional attunement that would help the person, the kid, grow into a healthy, fully functioning adult, whatever that looks like for them. Right.
Hmm.
So it's a much broader view of trauma than is recognized diagnostically.
Hmm.
And I think there's a lot of pushback to that, because people don't want to, one, say, hey, like the person who survived a war zone isn't as bad as the person who didn't get enough love for their mom. And I'll say, well, maybe. How do you know that? How do you know the
Right.
impact on their quality of life? And two, if we really acknowledge the extent of trauma and how pervasive it is, we all have to look at ourselves, because no one makes it out of their childhood completely unscathed. That doesn't mean
Hmm.
everyone has experienced trauma in their childhood, but certainly there's no one who had a perfect childhood. There's no one who has a perfect life.
Hmm.
So if we want to turn the lens on ourselves, that's confronting, right? Same when it comes to addiction. Everyone has addictions. Some of them are
Hmm.
very socially acceptable and okay. Some of them are maybe even good for us to a certain extent. And that's a very different way of looking at it. And that was part of the message in that Opioid Crisis song, is we really have to all look at ourselves and as a society, and how we're all, have these addictive tendencies, right? So
Hmm.
the same with trauma, the same with all of these things. When we can turn the lens on ourselves and confront something, then that might give us access to, one, to growing as human beings, but also having more compassion for others who are going through these things.
Hmm. And it sounds like you covered a lot of that in your song Perfect about perfectionism.
trying to write the perfect rhyme over the perfect beat, perfect words, perfect flow, picture perfect on repeat, perfect in my perfect thoughts, placed on paper perfectly, spoken with the perfect tone, perfection, what the purpose be? What is a perfect person? What is a perfect love? Can I feel the perfect high without taking the perfect drug? Many people dead from chasing down the perfect buzz, kinda fucked up what trying to be perfect does to a person's mind, to a person's goals. Fact of being humanly imperfect with the perfect soul. Perfect, just a word that restricts. If perfection is the goal, failure's what it predicts. Checking features of perfection off of an imperfect list. Only perfect expectation is the one that does not exist. If they tell you to be perfect, I insist that you resist. Perfection is oppression, so I'm raising my imperfect fist.
Perfectionism, I hear a lot talked about as, oh, well, this is just a character trait. I inherited that. Everyone around me is a perfectionist in my family, so that's just how I became. But looking at perfectionism as a trauma response is much more interesting, right? There's much more to find under the surface. Did you find that for yourself when you were doing a deeper dive?
Yeah, I mean, with a lot of these personality developments and ways we adapt or learn from our families, it's not all bad. Like there's like people who are perfectionistic are probably have way better attention to detail and will potentially produce higher quality products or outcomes than people who have very low standards of that and low conscientiousness. But of course, the fallacy of perfectionism is you can never reach perfect. And
Hmm.
in the quest for that, you may suffer a lot and actually get in your own way of doing a job that's excellent but not perfect. Right.
Hmm.
So everyone, like the people who say, "Oh, I'm just like this," it's like, of course you are. You are just like this, but that doesn't mean it's immutable. It can't change if you wanted to, right? And
Hmm.
that's the whole message of psychotherapy. And people, when people say, "Oh, it's just the way I am," it's like, yes, and does that mean it can't change, or it's just the way
Right.
you are, and you want to explore it further and perhaps change it because it's not always working for you, right?
Hmm.
So if you really take a look at the impact on one's quality of life of being a perfectionist or having a perfectionistic part of you be too dominant, there's harm that comes from that. There's limitations that come from that. There's a rigidity to it, right?
Hmm.
There's a lack of ability to say, hey, that's good enough and I'm happy with it, because you'll never be happy with it fully,
Hmm.
right? Never be able to fully enjoy the fruits of your labor or whatever it is you're up to.
Hmm. Yeah, and there's lots of good messages out there to try and move us away from perfectionism for those people that struggle with that when it becomes problematic. And at the same time, hearing it's okay to be imperfect isn't enough, right? So it goes back to what you were saying, doing that deeper dive in psychotherapy or through a program can be quite helpful because you learn about these different parts of yourself, which is a nice transition into the therapist part of you. I thought we could talk more about a theory called internal family systems. And I have experienced this with him in sessions. So it's been pretty transformative for me in my life. And it led me to dive into it myself as a psychotherapist and start using it with my clients. So I wanted to bring it to center stage today.
Yeah, so internal family systems is a therapeutic approach or model that acknowledges, as other therapeutic schools before it have, that when you look at a human being, you're not just dealing with one person, you're dealing with many different aspects of that person, right? And the idea that our nervous systems and our brains and our psyches are not just one uniform individual. In a way, there's many different parts or aspects of ourselves that make us who we are, right? So the Kirsten who's the podcast host in front of me is different than the Kirsten who's out hanging out with her friends, for example, right?
Mhm.
And everyone has that. So it's a even in common speech we talk about, part of me feels like this, but part of me wants to do that. Part of me wants to stay up late. Part of me knows I should go to bed and get well rested, whatever it is. And it highlights what a lot of the psychoanalytical tradition has acknowledged for forever, is that people can be conflicted between different parts of themselves, right?
Mhm.
And it's not usually how we conceptualize each other and ourselves, but when you break it down, you can really delve into and identify and distinguish who these different parts of you are, these different characters. It's a model that personifies these different characters, so it doesn't just call them, there's this drive or this instinct or whatever. It says, oh, like you could actually think of it as a part of you, and that part of you is doing something. It has certain qualities, and perhaps it's playing a role in your system or has even a job. And if you can
Mhm.
understand what that is, you can get to know it better and actually interact with it and
Mhm.
work with it. And why would you want to do that? One, I mean, so you can become more aware of what's driving you, but two, it's a way that you can start to and get to know yourself and alleviate potential sources of suffering or limitation there. So IFS acknowledges that we all have all these parts that make us who we are, and it also posits the existence of what they call a self with a capital S. So this is what sort of a part of you that's not just a part, it's like a core essence to a person that if you were to strip away all these parts and get distance from them, there's still something there. There's still
Hmm.
this awareness, this consciousness. They call it the self. Spiritual traditions might call it your soul. So it's kind of a psycho-spiritual approach in that way. But from that sort of seat of the self is where a lot of authentic and deep healing and learning and self-discovery can happen.
Hmm.
So that's a key distinction in IFS that perhaps isn't as emphasized in other parts-based approaches.
Mm.
And a big part of the intent as a therapist is to help one to come from that place of self as a therapist and not just a part of you with an agenda to get somebody to do something or change a certain way because we don't necessarily know what that person might need,
Hmm.
and to help the other person, the client, to realize that that's in them too. And
Right.
from that place of yourself and from that state that all kinds of deeper healing and growth can happen, sometimes very even spontaneously without us having to do a whole lot as therapists. But it's getting to that point and helping the person distinguish parts from the self that is the bulk of the work, especially in early phases doing this kind of therapy.
Hmm. What characteristics would you ascribe to the self that is different from these parts of us and the parts that make up this internal family?
Yeah, so I mean, the IFS approach itself has a lot of words they use, and they're for some reason they all start with the letter C. So the ones that usually stick out to me are the sense of curiosity, compassion, connectedness. They also talk about creativity and
Mm.
other qualities like courage. So there's this like open and receptive and curious and engaged kind of way of being that often comes with a sense of compassion or caring or desire to alleviate suffering that shows up when the self is present, and it'll look different in different people, but it's those same general qualities and feelings, sort of absence of any set agenda other than to perhaps be of help or to understand something or get to know something. And it's really from that place of self, in a way, in a paradoxical way, that the self-interests and biases that we normally have that come from parts of us, we kind of get some distance from them and we can really focus on and be with the person in front of us or the part of us that we're trying to engage with.
Mhm.
So there's a lot of overlap with mindfulness when people are in a mindful state, really receptive and open and curious and non-judgmental and all those things. There's a lot of overlap. I think IFS takes it a step further than just, observing and noticing, but actually stepping in and engaging in an active way.
Yeah, I think that's the part that was most intriguing and most the thing that threw me off the most in my first session experiencing IFS. We had identified a part of me. I don't remember exactly what part that was or what I was feeling, but going towards that part and talking to that part as if it was a person. Like you said, you personify the parts as part of this internal family.
Right.
And talking to that part, asking it questions, one of which being, how old does this part think I am? That one threw me off. First
Hmm.
session, I was like, who is this guy? I didn't know anything about the theory. But then when I came to learn the benefit of figuring out, are these parts in tune with the present or are they stuck in the past? That's really what the question's asking, right? Like,
Yeah,
is that part stuck in 6-year-old Kirsten or
exactly.
26-year-old Kirsten? So, yeah.
Yeah. I mean, especially early on, there are kind of weird questions and weird phrasing and everything. Some of that is just, I mean, some of it's the lingo of that approach, but some of it is just genuinely like I never even thought that part of me could be relating to me as if I'm still a little kid or
Yeah.
believing I'm a little kid. And, when you think about a lot of our survival responses and a lot of our personalities are formed in the very early years of life in our childhoods, it makes sense to ask that question, right?
Mhm.
Because if those responses aren't helping us in the present, they're not in tune to the present and not adaptive to that. It's one thing to intellectually know I shouldn't be so defensive. I shouldn't be so perfectionistic. No one's out to get me, right? My critical mother's not leaning over my shoulders, whatever it is. But it's another thing for the part of you that learned that and is actually influencing your behavior and your way of thinking and even perceiving to get that.
Mhm.
So how do you bridge the gap? And it's not going to be from more intellectual explanation. That would be from a part of you. It's going
Hmm.
to be from the self to help that part actually be attuned. And it's this whole distinction of like internal attachment, internal attunement with parts of yourself that allows that shift to occur.
Hmm. So getting more in touch with yourself through the what's called parts work, through inner child work. I find this approach interesting because it's not just inner child work. As I say that, it's like you could be
Mhm.
going back to a part that is only 2 years younger than your current age.
Yeah, right. It could be like an angry teenager, rebellious part of you. It could be a 5-year-old who's, scared or something. It could be you from 2 years ago who, you know, was not exactly in the same place that you're at now, right?
Mhm.
And even that can be a bit of a split in the psyche or a bit of lack of integration, right? So the whole point of this and a lot of therapies are about further, like more full integration
Mhm.
between parts of self so they can all work together. One analogy, if people struggle with this idea, is like, well, you have a body and you have a hand, and that hand is a part of your body, right? But it would be really weird to say this hand is not me, or this isn't, like if you were disconnected from your hand and it just did its own thing, that would be a problem, right? Especially if it's not doing what you want it to do. So, in the sense, it's a part of you, but it's still also you, right? It's very connected. What we do in IFS is we, in a way, accentuate the distinction, and from that distinction, then we can see where things have gone awry and then reintegrate.
Mhm.
So first, we need to distinguish and see and get something before it can change, and that's, even shown at interpersonal level in therapy. Like you have to understand somebody and get their world and get where they're coming from before you can know what might need to change and before they can trust you
Mhm.
to allow you in to help them change things.
Right. For sure. Yeah, building that rapport is super important. And I've even had clients share that they've had not so great experiences with therapists in past that maybe just go right into the depths before building that rapport.
Yeah, I mean, I've certainly done that myself as a therapist,
Mhm.
being too eager, and part of me that's like maybe a therapist part that's like, "Oh, I just want to help, I just want to fix things. Let's get in there,
Mhm.
and that people aren't ready for it and it pushes them away because it's not where they're at. They don't know who I
Right.
am. They don't trust me. So that is something I've learned over time to pay a lot more attention to.
Mhm. And I definitely have as well. I think in my student days, that was definitely a feeling, wanting to come across as the expert, wanting to present as knowing everything, which is not actually appealing to people. It's much
Yeah.
better to just be human, right? And to be in that state of self, as you're saying. So adopting those C words, I like that. Curiosity is definitely the most important thing to hold when you're practicing this and when you're open to it, when you're being the client in receiving it. And you had said, the best way to learn it is to be a client of it. So I'm curious, what appeals to you most about the IFS approach?
One, it acknowledges human beings are complex and there's not going to be like a one size fits all model that is just you can just impose on somebody, even though IFS itself is a model, and we can get into that too. But that people are complex and they have unique configurations of what make them who they are. It's definitely very trauma focused or trauma informed approach, like the
Mhm.
whole understanding that these aspects of our personality that are there on the surface are not just there to help us deal with and manage current stressors. They're also there to help us deal with and manage emotions, and often emotions that come from places that are unconscious or not so readily available to us. That's what they call the exiles, right? The parts of us that carry intense burdens of, past trauma, shame, whatever it might be, fear,
Mhm.
rage, and that you need to get permission from the protectors, these managers, to go there and do that deeper healing. And that's really what the ultimate goal, I think, or the direction an IFS therapist is thinking in. It's not just working on the surface with the day-to-day parts, but the ones that are beneath the surface, right? And
Mhm.
so it's a depth-oriented approach in that way, which appeals to me because I think that's where the deeper transformations that really impact people's lives will happen
Yeah.
and allow for their personalities to then be more flexible and adaptive to the present realities that a person's dealing with in their life.
Mhm.
I like that for me as a therapist. It helps me be mindful of not getting too hung up on things and getting frustrated when things aren't going, quotes my way, or, too stressed out about things, too anxious about things, because I know those are all parts of me. So
Mhm.
if I notice any of that happening, I can work with those parts of me either myself or in, a supervision or therapy session, whatever it may be. The other word, the C word from myself, is confidence. So when I'm in that place of myself, I'm a lot more confident, authentically confident as a therapist, not like you're saying, leading with a part of me that's like, oh, I must appear as an expert. I have to,
Mhm.
I have to make them know what I'm, that I know what I'm talking about. It's like, no, I don't. They'll
Mhm.
think what they'll think, and we'll deal with what comes up. And that confidence is contagious, right?
Mhm.
When you're authentically in that state, others can feel it and their parts can pick up on that over time and
Mhm.
realize, oh, they're not judging me. Oh, they're not trying to hijack and my this session and tell me where I need to go. They're not trying to tell me what to do. They're trusting me and myself that I can figure that out. So I like that part of the approach as well.
Mhm. And you use the word protector and manager and
Mhm.
exile, and these are terms to describe the different parts of us. Would you mind giving an example of what a scenario like that might look like, where there's a protector and a manager and exile, and how they might interact for the client?
Yeah, so if somebody at certain points in their life experienced being very severely embarrassed, ashamed, or made to feel ashamed
Mhm.
about some part of themselves, right? Like someone who was, say, bullied a lot for being too nerdy or something, right? So then they may have internalized this message that I need to hide my quotes nerdy interests, and shame will help do that, right?
Mhm.
And then later in life, maybe parts of them still really like whatever they liked as a kid. Maybe it was, Star Wars or whatever. I'm a Star Wars nerd myself. I say that proudly. Um, and so they're on guard against being judged those same ways because that was a really painful experience. Right? They don't
Mhm.
want to. They don't want to feel that again. So they will, the person will develop parts of them that then try to prevent being judged that way or seen that way, or those parts of them being seen by others. And those might be the managers.
Mhm.
So these parts that help us manage our lives, trying to manage external relationships to prevent judgment. So maybe they help us present ourselves a certain way. This is more classically what would be thought of as, just defenses, basically, psychological defenses against something. In this case, judgment from the outside. But why are you so concerned about that? Because it would cause so much pain inside, right? It would cause the triggering of the exile that carries all this shame to come
Mhm.
up. And that would be painful and perhaps overwhelming for the person. So the managers work to keep that at bay. And then they also have the other classification of parts is firefighters. So managers are proactive in trying to prevent exiles from being triggered.
Mhm.
Um, the firefighters are there to put out the fire if the triggering has already happened. And the firefighters tend to be more impulsive and not really care about the damage done to put out that fire, much like a firefighter. Well, not that they're impulsive, but you don't care about damaging the door or the furniture when you're trying to save the baby from the burning house, right?
Right.
So again, if the following that analogy, it could look like, flying into a rage to get somebody to back off. It could look like, impulsively, using substances, binge eating. It could look like, dissociation and shutting down. It's something that just makes that horrible feeling and all of the associated memories and experiences go away because it's too
Mhm.
much. It feels like too much. We can't handle it. Got to put it out. Right.
Mhm. So in that example, then maybe a protector would be perfectionism, right? Back to what we talked about before. Like if that person in this example is feeling embarrassed and they don't want to feel that embarrassment, a protector comes in to say, okay, well, if we present as perfect all the time, then we can avoid embarrassment. And then if there is embarrassment, then maybe a firefighter goes out and gets blackout drunk, right? So just looking at how all the parts
Yeah. Yeah.
interact, I have found so helpful in figuring out my stuck points. Like my internal wounds, my habits, and then being able to visualize those parts has been
Mhm.
really helpful. When I talk about this with clients, I refer to the Inside Out movies.
Mhm.
The in that those movies for people who haven't seen it, there's all these little people in their head and
Mhm.
they represent different emotions. So, do you do that yourself when you're thinking about parts work? Like do you imagine visuals of those different parts as little people or as things?
Yeah, I mean, everyone's system kind of presents differently. I find it's really cool when people can visualize and notice them and see them, because then
Hmm.
it's like you can simulate in your brain having a real interaction with somebody and get the cues. Sometimes some people actually can't visualize anything. And some people's systems just don't present that way. It might just be more of a voice or thoughts in their head. It might be more of just a sense of something.
Hmm.
Might be a lot more physically based in the body. So definitely flexibility around that. But for those who can picture something, like I'll often ask people, how do you know it's there? How does it show up? And kind
Hmm.
of map different possible areas of experience. So, like, are there physical sensations in the body? What happens when you focus on those? What kind of thoughts come with it? Or is there a certain voice? Is there an image that comes to mind? Right. And so, whatever way that person is able to focus on it and really resonate with it, we go with that. But
That's a cool part of it too, the somatic element to look at. Where does it show up in the body?
mhm.
That's why this approach is so cool because it covers so many different facets of therapy.
Yeah, and because a lot of times that helps us get out of our more just thinking, cognitive, intellectual realm and those
Hmm.
parts of us and into trauma and certainly emotion, it's going to show up. There's going to be some physical manifestation of it. And by directly focusing on that is a way to kind of, I think, get more ready access to stuff that is kind of unconscious and
Hmm.
let it come into awareness, right? I think a lot of times I think about it as negotiating with all the protectors, managing parts, to give enough space for things to arise. And then you don't have to do that much at that point. If something needs to come up, it just kind of comes up, which is cool.
Hmm.
And, sessions can often go directions we wouldn't have predicted if we were just following it logically from a logical part of our brain.
One thing that I have found helpful in the approach too is from your suggestion, like closing your eyes to be
Hmm.
able to tune into the parts. And I've recommended that with clients too. Obviously, everyone's comfortability is different, but
Hmm.
for me, that's helped because when you're trying to focus on identifying the parts, even if you're not visualizing them as little creatures in your mind or little
Hmm.
versions of you, there's just lots of distraction around, like looking at the therapist, looking at stuff in
Hmm.
your room, and so that's been cool too.
Yeah, definitely. When people are comfortable closing their eyes to focus, it just kind of helps. I do that when I'm engaging with it myself because it helps tune out the visual stimulation and distraction and really focus on the internal world, which is what it's about. It's an
Mhm.
internal, family system. So um, getting more of a direct, perceptual sense of what's going on inside, right?
Mhm.
Which, being very visual oriented creatures and very, in this part of the world, very cognitively oriented beings, anything that helps us to notice what else is going on, especially in our sense experience, which often is where the body can be super helpful. When I visualize a picture in your head right now, I find it easier to not have competing visuals coming from the external world into
Mhm.
my brain, right? So just being able to picture something, closing the eyes, is
Yeah,
it allows us to
absolutely.
go kind of deeper. Some people at the end of an IFS session be like, "Oh, I feel like this now. Like, did you hypnotize me?" I'm like, "Well, one, I don't fully understand what hypnosis is, and two, no, I was following your process and helping guide you somewhere." Right?
Mhm.
So it's just such a distinct, kind of almost trance-like state that one can get into when you're
Mhm.
in this sort of just self-led kind of exploration.
Yeah, it does kind of feel like that, like a hypnosis. I haven't been hypnotized, but I can only imagine that sense of like you open your eyes, you're back to reality, and then that integration happens.
Yeah.
And what would you say is a part of integration that you help clients with at the end of a session? Like they come back from the parts work. What do they do now? How do they take what they've extracted into their day to day?
A couple different things. If you've done, like, say, an unburdening, as they call it, of an exiled part of you, it's like helping that part of you take in certain qualities that it might need to move forward in your life, and
Hmm.
also a way that you can stay connected to it in the days that come. So if somebody connected very strongly with a part of them in their gut, and that's where it shows up in the body, and there's this image of some that comes with it, I'm going to encourage the client, like, once a day for the next, couple of weeks, take some time to tap into that part of you, connect with it there, and just check in with it, see if it needs
Hmm.
anything, talk to it, because that will help it get more fully integrated into the present, and you become more aware of it in the present, which is kind of one and the same.
Hmm.
Pretty much at the end of every session, I ask people to if they have feedback, but also to check in with their system. Does any part of you have feedback about what we did here in the session today? that's also part of the integration too, is like if you go to a deeper place of an exile that's wounded and help to heal it or alleviate that suffering, you then want to check in with all of the managers and protectors who have been dealing with this for you or helping you deal with it to say like, did you guys see what we just did? What do you think? Because then they may want to adapt and change. Be like, wow, that part of you that's always terrified is pretty calm now. Maybe I don't have to be on guard as much anymore.
Mm-hmm.
Maybe I can relax a bit. Maybe I don't have to look out for threats everywhere 90% of the time. Maybe I can scale back to 50, right?
Mm-hmm.
Maybe I don't want to be a perfectionist anymore. Maybe I just want to help you assess what's good enough and strive for
Mm-hmm.
that. So the roles of these protectors can change. So
Mm-hmm.
that's part of the integration work is helping all parts of yourself know what's going on.
Yeah, it's like a debrief for all of them.
Yeah, right. And we're doing that very consciously and explicitly because that may help facilitate the change to really stick.
One thing that I just wanted to share with IFS and my experience delivering it as a therapist is I find, I'm curious if you find this as well, that some of the most impactful moments are you're tuned into a part, one of their parts from their past, and you ask them what they would need, what that part of them would need to hear from them now. Like, is there something that 6-year-old you in this example needed to hear when they were 6 that they didn't hear?
Mhm.
And what could you tell them that they needed to hear? And it's just like tears instantly in a good way because it's
Mhm.
this release of, oh my God, I'm being that secure adult for
Yeah.
this younger part of me that didn't hear these things that I get to now say to this part.
Yeah. And the tears often is because it's meaningful, right? Because it
Hmm.
is something you needed and are doing for yourself now. And how cool is that, right? So, the relational psychodynamic approach, the idea is that, I as a therapist, you as a therapist become the secure attachment figure that then that person can internalize and that will be healing for them, right?
Hmm.
Maybe I'm the one who says to you, it wasn't your fault, right? But how cool is it that I don't even have to say that? And I say, is there anything you would have wanted to say or want to say to that part of you now?
Hmm.
Because you're going to know better what you need to hear. You're going to know better what the words are. And if
Right.
you say them to that part of you, even the agency is greater, right? You're doing your own healing, really,
Hmm.
and explicitly doing that. So that's a really cool distinction, right? What would you have needed to hear, and
Hmm.
and or whatever, what would have needed to happen? You go do it. Sometimes it's words. Sometimes it's go fight off those bullies for them and take them somewhere safe, right? Whatever it is. Sometimes it's a big part of it. Sometimes just like, oh, someone's here who gets it when I was alone and no one got it, right?
Hmm.
It's very empowering to know that you're that secure attachment figure, and that the goal with where you're looking at is the same, that becomes internalized, right? A sense of safety, a sense of I'm okay because there's somebody here with me. I'm competent, I can handle things. For
Hmm.
the younger parts of us to know that is life changing,
Absolutely.
and the more that that's evident, the more that whatever that need is taken care of, the less other parts of us need to jump in and do it for us, and then they
Yeah.
can get freed up to help us with other things, right? So the party that's always worried about keeping this upset part of you not being upset or not impacting you can now, it's like, oh, I don't have to do that anymore. Or even maybe I can just help you do that and do other things too. Frees us up.
Yeah, that's great to look at. What's the new role of that part going to be? The part that was busy, I don't know, being a perfectionist or being on guard, and they don't have to do that anymore and giving it a new role. That's always cool to see too. For me, the role
Yeah.
is usually just being a kid if the part was a kid that we were tapping into, or being able to help, like you mentioned with perfectionism, that it can be helpful in some ways. It can help us be productive. But if we can rein it in at like a 5 out of 10 versus a 10 out of
Hmm.
10, then it's not draining. It's not a strain.
Yeah. Exactly. The exiles, one of the ways to distinguish an exile from a manager is, does it have a role? And usually the
Mhm.
managers have a clear role. The exiles, they don't have a role per se, although the role in the system is they hold all of the pain and they're
Right.
burdened with it. But once they're freed up, it's like that vital energy that was there is now part of you and it's more integrated and you can use it. So somebody was shunned for their creative pursuits. Now that creativity comes back into your life and it starts
Mhm.
showing up in ways that it maybe hasn't before, right? There's a lot of fear restricting you. Now that part of you is not afraid. You have this new access to courage in your life to
Mhm.
take risks. So this goes also back to Freud and early psychotherapy analyst, but the idea of like, he called everything libido, which people just think is sex drive, but what he really meant was like vital life energy,
Mm.
or, in Eastern traditions, you might call it chi. And like acupuncture tries to help unlock the chi, and whatever. There's all this, it's the same thing. You can talk about different ways, but it's like you remove the blocks to that flowing within you, this life force,
Mhm.
this energy, this whatever you want to call it, and now you are freed up to be more fully alive in your life in whatever ways you choose. I think that's ultimately the deeper healing that happens. And once that enough of that has happened, the person doesn't actually need as much help or guidance
Mhm.
from a therapist, because they have so much more capacity within themselves that should have been there in the first place, but got stifled for whatever reason to grow and figure things out.
Absolutely. Looking at it as a life force is a really beautiful way to conceptualize it, the self as being this life force that exists within us that we can access anytime. And I totally agree. Once you work through certain things, like Gabor has said, there is no final healed state,
Mm.
but there are things that he's worked through, things that used to bother him that don't bother him anymore. And so it's not to say that there won't be blockages that come up in the future, but life gets way easier when we can move some of them out of the way in the meantime.
Yeah, absolutely. I mean, sometimes I'll explain to people like, no amount of therapy is going to make life easy all the time or
Mhm.
perfect or make you happy all the time.
Yeah.
But by doing this deeper work, you will be freed up to meet the challenges of your life today without having to also contend with every other single time you encountered a challenge and got
Mhm.
burdened with something and an unhelpful response to it. It's hard enough to make it in this world for anyone, just dealing with present reality and challenges that are there. But
Mhm.
combine that with having now also to deal with keeping at bay all of your past pains and failures and traumas. That's where it feels like too much, because it is too much
Mhm.
for us to carry. And then we're not able to as adaptively meet the present day challenges. So that's, I think, the great promise of doing this deeper healing in therapy or through whatever means you do it, is that, it's one thing to say the past is the past. It's another thing to have the past not impact you in a negative way in the present.
Mhm.
And that's, how do you do that? The how is, I mean, IFS is one method of how.
To wrap up today's episode, I asked Daniel what advice he would give to listeners who are interested in starting psychotherapy.
Being clear about why you're seeking this help, like what are the stakes for you? Why does it matter? Is
Mhm.
really important, and keeping that present, because it's not always fun or enjoyable or a pleasurable experience to self-examine and to, it's often stressful and painful and anxiety provoking, right?
Yeah.
Sometimes it is very positive in other ways. So to be clear about like what you want, because the more clear you can be on that, the more clear you can be with your therapist on that, the more you're going to be able to be aligned towards addressing that. So
Mhm.
clarity on that. The fit with your therapist is super important. So when you're researching different therapists, assuming you have the option to choose, to really take some time to read what they've written about themselves, their approach, see what resonates with you, what calls to you. And also, if there's a chance to consult with people, like have a brief call with them first to talk to them and see how it feels, and get your questions answered. Do that before, just because there's no one size fits all. No one therapist can help every single person. And not all therapists are created equal. There are some, like any profession, who are better than others. So, looking at um, taking all those things into account, and feeling out what actually feels like the best fit. And I think the main thing is, in the therapeutic relationship, that you can express yourself openly about what's working or not working for you in the therapy. And you
Mhm.
have a therapist who's receptive to that and will work with you and through that with you, is super important. When people get referred to a publicly funded service that has a mandate to do X amount of sessions with a certain modality, you don't get that choice, really. It's like,
Mhm.
you're not paying for it, or it's government funded, whatever. This is what you get. And sometimes that's a negative or harmful experience. Like, I was just thinking about this yesterday as I talked to a client who has many attempts at therapy that were not helpful, and some that might have even been harmful.
Mm.
So therapy is not always, for everyone all the time, a positive experience. And if something is telling you this is bad, it's like you need to talk about it with that therapist. And if they're not willing to talk to you about it or work through with you, don't stick around. Find someone else,
Mhm.
right? So listen to your gut about that,
Yeah.
That being said, if you do have, red flags or alarms going off and you don't assume it's all the therapist either, it could be your stuff. So that's why I
Hmm.
say talk about it with them, explore it with them, see what's really going on
Hmm.
first. Also, address your expectations, right? A lot of
Hmm.
people think I'm going to go to therapist and they're going to fix me, they're going to teach me something, and then I'm going to be better. That's
Yeah.
not how it works, really. You can learn skills, you can learn things from the person, but ultimately it's about the process of changing yourself,
Hmm.
right? And that's the hardest work there is to do, is to change oneself. The therapist is there to help you do that and guide you to
Exactly.
do that and see where you're stuck and not able to, or not seeing things that may be in your way. But if you expect them to fix you or change you or be sprinkle some therapy magic on you and you're going to walk away feeling better, it's not really what psychotherapy is about. You can find people who might make you feel better about yourself and validate everything you say, and that may feel good in the short term, but long term, for most people, it will not be sufficient for meaningful change.
Yeah, absolutely. And I use that expression a lot. I help people help themselves rather than I am this all knowing being.
Yeah.
And that's more of the old school model, right? Of like being in the seat of power, and breaking down the power dynamic is far more interesting. And I learn a lot from my clients. I'm sure you do too. And it's cool to have that type of relationship. It opens up the door for way more parts to integrate, right?
Yeah. We are at times very active and engaged in the relationship and impact. We are directly impacting people
Of
through
course.
those relationships. But I still think the bulk of the responsibility and ability to change is with the client.
Hmm.
And so if you come in to the person seeking therapy, you come in with that mentality of like, I got to do most of the work here. This person's there to help me where I'm stuck. You're going to have a way better time than coming in and thinking, here's my problems, fix me.
Hmm.
Because you're going to very quickly learn they can't fix you, and they can't fix all your problems. Maybe you don't. Maybe the problem is you think you need to be fixed in the first place, right? Like whatever it is.
Right.
So the more active role you can take and collaborate with the therapist, the better it's going to go. And most therapy research supports that. It's about the strength of the therapeutic alliance, being on the same page towards a common goal that you're working towards, having some approach or approaches that you both buy into,
Hmm.
and ways of exploring that. When those are all in place, you're much more likely to have a positive outcome.
Well, thank you so much, Daniel, for being with us today and sharing your knowledge. I really appreciate it.
Yeah, thanks so much for having me. It's been interesting to have a different kind of interaction, different dynamic, and be on more on the hot seat than I usually am in our
Yeah.
interactions. Usually the focus is mostly on you, but I appreciate the opportunity too. And I'm curious to hear for you what it's been like to be in this role with me doing this as opposed
Yeah.
to the
Yeah.
usual role that we're in.
Mhm. No, I appreciate you asking that. It's definitely a different dynamic. Before the interview started today, there was a bit of nerves around, oh my God, am I actually going to release an episode where I'm talking to my therapist and I'm interviewing them? Up until yesterday morning, I was
Hmm.
thinking, this is a great idea. And then yesterday morning, I'm like, oh shit, is this a bad idea? It felt like, wow, this is very vulnerable. One, to just be putting it out there to the world who my therapist is, but I also have to practice what I preach, and I advocate that therapists need therapy too. So
Hmm.
this has been cool. This has been outside of my comfort zone, absolutely. So thank you for being a part of that, because this is a cool step towards growth.
Yeah, absolutely. Similarly, when you first asked, I said I got to think about it because all the ethical considerations, and then we met and we talked about it, even drafted up a very formal looking statement of understanding that says this is
Yes.
what we have agreed to. This is worst case scenario. This is so we did all that, and I think that's important. But despite that, coming in, there's still a bit of nerves, like parts of me are
Mhm.
like, what's going to happen? What's going to show up? Some of the questions you ask, I'm like, oh, I'm got to be vulnerable here, right? And so noticing even autonomically a bit of nerves coming up
Mhm.
as we talk, and just being like, oh, okay, so that's interesting and something to be mindful of. And it's also cool, like you said, it's like maybe there's some growing going on, some learning, something meaningful happening, something interesting happening. It's not just a boring conversation, which hopefully that'll get translated into the ears of the listener as well.
Mhm.
Most clients of therapists are not going to invite their therapist on their podcast and say, "Yes, my
Yes.
therapist," and most therapists are not going to start disclosing extensively about their own personal stuff because just don't do that as a
Yeah.
therapist in a therapy session. It's not about you. So it's a cool experience. And I think that's what excited me about this too. It's like a unique angle to bring to it.
Yeah. And I figured that too, because after listening to your lyrics, it's like, okay, well, clearly there's more of a critical eye in a positive way, like approaching mental health sphere with critical thinking, pushing boundaries in a healthy way, in a way that invites this type of vulnerability in for other people, because it's not easy for some people to even push the start button on therapy, let alone to talk about who their therapist is and to talk about the processes that go on there. But yeah, breaking the barrier of vulnerability is definitely nerve-wracking, but also really rewarding.
Yeah.
Thank you so much for listening. If you're enjoying the podcast, I invite you to participate in a Growth Zone challenge. I invite you to take a moment, a second, a gap in your day right now and share this episode with 2 other people. Thank you for minding the gaps with me. I'll see you next time on the journey out of our comfort zones and into our growth zones.